Hi everyone, today I am going to talk about total joint replacement. In total joint replacement, both the constituents of the joint are replaced. For example, if it's a hip joint, then the acetabulum and the head of the femur will be replaced. In partial joint replacement, only the damaged part of the joint is replaced. Again, if we take the hip joint as an example, either the acetabulum or the head of the femur will be replaced according to which side is damaged. For a few patients, after doing the surgery, they become better. For the next 10 to 15 years, they don't have any problem doing their daily day-to-day activities. But for a few of them, their condition becomes worse. So this depends on these factors. That is the skill of the surgeon, the understanding of how the joints work, and how much the joint was mobile before the surgery, and the standard of the operation theatre and the post-operative care, because the patient might contact infection from a not well maintained operation theatre. In case of a total knee replacement, the name itself is a misnomer, because in this case we don't replace both the parts of the joints that are involved. Instead, we remove only the articular cartilage which is damaged and then replace that articular cartilage with artificial prosthetics. Going to the indications and contraindications of knee replacement surgery, indication is disabling arthritis, which means the patient is not able to walk anymore. Then contraindications are pre-existing infection. For example, if the patient already has an infection, then whatever prosthetic which may be inserted will be degraded by the existing infection. Weak extensor mechanism. In this, if there is an old patient who is not able to get up from the bed because of weak muscles, then there is no use of doing the joint surgery, because the patient will not be able to get up from the bed anyway. Then pre-existing nerve injury and young obese patients with physically demanding work. If they are a young obese patient with demanding work, it will increase the load on the joint and therefore it can cause fractures. So it is not advisable. Components of the artificial joint. So the artificial joint has a femoral component, a tibial component, a spacer in between, and a patellar button. So the femoral component is U-shaped, and the tibial component is also called as the tibial base plate, and the plastic spacer will make a space between the femoral and the tibial components, and the patellar button is used to replace the patella which may be damaged. So this is a picture of the artificial knee joint, where there is a femoral component which is U-shaped and it cups the artificial cartilage of the femur, and then there is a patellar button, and then there is a plastic spacer between the femoral and the tibial component, and there is a tibial base plate. Procedure. First, the damaged cartilage is removed, then the alignment of the leg is made, then the ligaments of the knee are arranged in such a way that there is a balance between them. Newer techniques involve computer navigation of the procedure. This makes the operation more safer with lesser side effects. This picture shows how the joint replacement is done. Now moving on to the complications. These are the complications which will be explained one by one in the next slides. So first is infection. Infection can be introduced into the body during the operation, or it can occur from another site of infection in the body. So if there is an infection, it requires IV antibiotics, and if they are not able to control it with IV antibiotics, it requires another operation, and sometimes the knee joint may have to be removed, and both the bones needs to be fused so that the infection can be controlled. Deep vein thrombosis, it's one of the other complications. Here what happens is the blood clot is formed in the leg due to prolonged immobility, because after the surgery the patient may be on the bed for a while and they may not be able to move just yet. During that time, because of the increased hypercoagulability and viscosity of the blood, and because of the altered blood flow, there can be endothelial damage which leads to a clot formation in the veins of the leg. And then when the patient is suddenly able to move again, then the patient moves and the clot gets dislodged. It goes into the pulmonary artery and it blocks the pulmonary artery, and because of this the oxygen perfusion is reduced. This is a medical emergency and immediate surgery is required to save the patient. This can be prevented by giving IV heparin or subcutaneous heparin. Heparin is an anticoagulant. Because of giving heparin, these days the complications of deep vein thrombosis is very rare. During surgery, the most common nerve involved is the common peroneal nerve, because when the surgeon dissects laterally, they may sometimes involve the common peroneal nerve. This can cause food drop and loss of sensation. And the treatment for this is nerve decompression, physiotherapy, and we can investigate this using nerve conduction studies and electromyography. Fracture is another complication because of weak bones in the old age, also called as osteoporotic bones. When the prosthetic is implanted, it can cause fracture, or else when the patient is walking, when there is a heavy weight put on the prosthetic, it can transmit that weight to only one particular area in the bone, which causes fracture in that area. Extensor mechanism complication is basically the ability of the patient to stand up is because of the extensor mechanism. So if there is any tendon that is injured during the surgery, then the patient might have difficulty in standing up. This can be corrected by surgery, or it can be corrected by physiotherapy. Knee stiffness is the last complication. Here there may be intra-articular adhesions which leads to limited range of movement, and because of this the patient may experience difficulty even after surgery in continuing their day-to-day activities. This is treated by aggressive physiotherapy along with pain management, and in very severe cases we can do surgery. Thank you for listening to this video. Please like, share and subscribe.